This presentation explains how your benefit trust fund covers routine total hip replacement or total knee replacement surgery. If you have questions, please contact the trust fund office at 1-831-757-5265. You will have a significant incentive to use an Anthem Blue Cross designated hospital if you need total hip replacement or total knee replacement surgery. This is one of 3 benefit changes that are effective as of October 3, 2011. Be sure to watch the other videos on this site to learn about the additional program changes. If you take the time to understand why the changes are necessary and what you need to do, you will save money without sacrificing any quality in your care. Let's first talk about the rationale for changes to the way we cover routine total hip or total knee replacement surgery. The cost for these surgeries can vary greatly among providers in the Anthem Blue Cross network. For example, one local hospital charges around $20,000, another hospital charges around $45,000, and yet another charges over $70,000 for knee replacement surgery. Yet there may be little evidence of a higher quality of care at a higher cost facility, and this fact can cost you and your benefit trust fund thousands of dollars. So your benefit trust fund is putting in place a new benefit design for routine total knee or total hip replacement surgery. We are working with a group of hospitals within the Anthem Blue Cross network who have agreed to charge no more than $30,000 for these surgeries, and this will become the maximum charge allowed for these surgeries. There are over 40 hospitals on the Anthem Blue Cross designated hospital list, including UCSF Medical Center, Good Samaritan, and Community Hospital of the Monterey Peninsula. And if you decide not to use one of the designated hospitals for these surgeries, you will be responsible for any amount over the $30,000 maximum. If you need to travel more than 50 miles from your home to a designated hospital, you may request reimbursement of up to $750 of your travel expenses. This reimbursement may be considered taxable income by the IRS. Here is an example for routine total knee replacement surgery. This example applies to participants in Plan 2. First, you can see how the hospital charges might vary based on whether you decide to get your surgery through a designated hospital, at an Anthem Blue Cross Network hospital, or through an out-of-network hospital. The designated hospitals agree to charge no more than $30,000 for these surgeries. However, as we told you earlier, other hospitals may charge much more. In any scenario, you pay your share of coinsurance until you meet your annual out-of-pocket maximum. Then your trust fund pays the balance up to the $30,000 maximum charge. At a designated hospital, you won't see any additional costs. However, at a regular network hospital or out-of-network hospital, you are responsible for your coinsurance plus any amount over the $30,000 maximum. So it will be very important for you to consider visiting a designated hospital if you need routine total knee or total hip replacement surgery. Here is the current list of the Anthem Blue Cross designated hospitals participating in this program. Be sure to call our Care Counseling service if you are planning routine total knee or total hip replacement surgery. They will help you confirm you are scheduled at a designated hospital and work with you to pre-authorize your surgery with Blue Cross. Also, you can request the most up-to-date copy of the designated hospital list from the Trust Fund office. We also encourage you to take a look at the Care Comparison tool on the Anthem Blue Cross website. You can use this tool to compare how hospitals and providers stack up on a range of factors. You can look at the number of patients they see per year for a given procedure, the number of patients who experience complications, the average length of a hospital stay related to a given procedure, the level of satisfaction that patients had with their treatment, and the average costs for a given procedure. This is critical data that can help you decide on the hospital you want to work with, not only if you need knee or hip replacement surgery, but also if you need to stay in the hospital for other procedures. You can access this tool through www.anthem.com/ca. You will need to register to use this tool, so be sure to have your benefit plan ID card handy. If you have questions about the changes we are making to our total hip and total knee replacement surgery benefit, call the Trust Fund office at 1-831-757-5265. You can reach a representative Monday through Thursday from 7 a.m. to 5 p.m. or Friday from 7 a.m. to 3:30 p.m. Pacific Time. We also hope you will take a look at the Fund's new website. You'll find information about your health and prescription drug benefits, how your benefit trust fund works, and links to program resources. So thanks again for taking the time to review this presentation.